Hello, everyone. Welcome back to the Beat podcast, recorded live here in Los Angeles from the Vive conference. I'm excited to be with Golinkin again, president of Babson Diagnostics. He was with us in November at Health. I'm excited to provide another update from him and his company. Webb, so great to see you again.
It's great to be here, Saul. I'm enjoying this conference, and there's a lot of exciting news and development about Babson and our BetterWay system that I'm looking forward to sharing with you and your viewers.
Thank you, Webb. We're excited to hear it. So for those that haven't heard about you or the company, let's start there.
Yeah, so Babson's story is a very unusual story. So the company was started as a Skunk Works project at Siemens in 2015, spun out of the company Siemens in 2017, hooked up with Becton Dickinson shortly thereafter, and literally for the past decade has been developing a fingertip blood collection process and ecosystem that we've proven has significantly preferred by patients versus conventional methods. We now have a test menu of 68 tests that represent more than 80% of what's normally ordered in primary care. And for the last year or so, we've been taking it into the mainstream of the healthcare industry. We're already been commercialized in Austin, which I can tell you about. But this is truly a science-first company. I mean, we've spent the last decade developing and validating the technology. And we've proven that not only do patients prefer it over conventional blood testing methods, but you can train anybody to do it. So you don't need a phlebotomist. And that unlocks decentralized locations, enables providers to acquire new patients, to reduce leakage. So there are lots of benefits, both in terms of the quality of care and outcomes, as well as financially.
I mean, I know I don't like going to the doctor and then having to go to the get my blood exam. Hey, this is kind of helping me do it in one place.
Yeah, no, it's, I don't think really anybody likes to have a needle stuck in their arm. I mean, I don't know anybody that does.
I don't either.
And if you look at the research, about a third of patients are non-adherent to testing, so you can imagine what kind of problem that represents. So for patients, you end up with worse outcomes. For providers, you're losing patients. And for payers, it's much more expensive at the end of the day when you don't catch things early. So, there are lots of issues related to that specifically, but there have also been some recent surveys which show that as many as 80% of patients have some level of anxiety about getting their blood tested. So not only there's sort of the needle phobia problem, but there's also just general, I just don't really like this experience.
Yeah.
And so if you can offer an alternative, there's a significant opportunity for providers who are offering BetterWay to just increase patient satisfaction generally. And I think that, ramifies, potentially throughout their organization.
Totally. Yeah, big impact it unlocks access in a new way.
Note, that's a really good point. And one of the things that's happened, I think, since the last time we spoke, is that we've made an agreement with Gabby Thomas.
Okay.
So Gabby was a 3-time gold medal winner at the last Olympics in Paris. She's going to be competing. She's a sprinter.
Oh, she's a sprinter?
Was the fastest woman in the world at one time. She may be now still. But the interesting thing about Gabby is that, from our point of view, is not only is she a celebrated athlete, she's got more than 1 million Instagram followers, but she's got a neuroscience degree from Harvard and a master's in epidemiology from the University of Texas. And she loves BetterWay. And the reason she loves it is because she believes that it will increase access. So you mentioned access, and I think that's the key here. By offering a patient-preferred blood collection and system, you can reach people that otherwise, have been non-adherent to testing or just simply don't like the process.
Webb, we literally just did an interview on community health workers and their impact in health. And I'm just thinking, what an unlock there to be able to match a technology like this with community workers that can deliver the care with trust.
No question. It's, and I've been in the outpatient world for 25 years. Prior to joining, Babson about a year and a half ago, and I'm very, I had an opportunity to observe the limitations of venipuncture. Basically patients don't like it, so a lot of them don't get it. And then from an operational standpoint, if you're a provider, you may have somebody in an outpatient facility who's a phlebotomist, but it's more likely that you have somebody who's cross-trained as a phlebotomist. Maybe that person doesn't show up that day. Maybe they don't do it that often, so maybe they're not very good at it. So the opportunity to basically cross-train, all of your team members in a clinic to be able to collect blood is a pretty significant operational advantage, we think. And there's another piece of our ecosystem, which is, we collect basically 90% less blood. And then in our mini draw tube, which is an FDA-cleared device, we then drop it into our automated sample preparation device. And that device mixes, centrifuges, and stores the samples at cold temperatures until they're picked up by our couriers. And so every part of the process is automated. There's no labeling because the tube is barcoded in the factory. And so we're reducing pre-analytical errors, which is the source of a lot of the problems with blood testing today. So it's not just the blood collection process, it's the sample preparation process, as well as what we do in our CLIA-certified CAP-accredited lab in Austin.
Well, it sounds like it's a very well thought out system.
It's amazingly well thought out, and I'm not taking credit for that. As I said, I've been involved in the company for the past year and a half, but there are many terrific Babson team members who, in a very science-first way, in a very scientifically rigorous way, have developed this technology and then systematically gotten it validated. And so, the evidence of validation is 45 IRB studies, 4,300 study participants, more than 850,000 tests run, and now 2 peer-reviewed journal articles that have established without any question that our results are clinically equivalent to conventional methods.
Well, that's fantastic. And what attracted you to the project?
Well, as I said, I've had a chance, over the past 25 or 30 years to observe the limitations of venipuncture. And, 70% of medical decisions are based on blood testing. And yet there hasn't been any fundamental change in the way blood has been collected in 7 decades. And so when I found out about Babson and learned, more about it, I just, kind of couldn't resist the temptation to want to help the company bring this technology into the mainstream of healthcare. This is an area that needs attention. I think the technology we have is transformational. Having said that, this is an exercise in change management for the reasons I suggested. This is not something where you flick the switch and suddenly, everybody's going to offer BetterWay. It takes time to make sure for large providers, including but not limited to health systems, to understand the benefits, to be very sure that, our results are clinically equivalent. Fortunately, we have all the data to prove that, and to work with us to build, a parallel system here that patients prefer, and that operates, that offers operational efficiency at the same time.
Totally. Yeah, it's a big opportunity. And when you think about patient experience as a competitive differentiator for providers, how does BetterWay fit into that?
Yeah, I mean, what's interesting is that one of the biggest trends in healthcare, as you know, Saul, is that it's moving away from the hospital more into ambulatory and outpatient care. And I've participated in that, so I'm very familiar with that territory. That's where the puck has been going. And, that's great, except the result is that it's much more competitive than it used to be. It used to be when I was, one of my companies was a pioneer in retail healthcare, and I led a very large company that operated more than 170 urgent care clinics. The biggest differentiator at the beginning was just simple convenience. If you put healthcare clinics in close proximity to patients, that was just a major step in the right direction. If you had it open 7 days a week, extended weekday hours, all of those things, that was enough. It wasn't enough by itself to succeed, but that was the main draw. Now, with the increased competitiveness of ambulatory care, I really believe that patient experience is the single biggest differentiator. So that's the opportunity that we have with providers to offer patient-preferred experience. And so, I think patient experience is at the core of everything now, and we're able to offer it in a way that's in an area that's fundamental to medicine.
Listen, we love Starbucks and Amazon and streaming. We want the same thing in healthcare as consumers.
Yeah, no, I think we do. And at the same time, we, in a sense, we're taking advantage of providers' move towards more ambulatory care, because what they've done is they've invested in convenience. And so we're not trying to go around them. We're trying to offer them the ability to offer this BetterWay service, using their infrastructure. So they're providing the convenience. We're enabling them to offer a patient-preferred blood testing experience. And so, we envision very strong partnerships moving forward.
That's fantastic. What are the most underappreciated levers that ambulatory care strategy that move the needle on growth, and where does blood testing fit in that?
Well, look, as I mentioned, blood testing is 70% of medical decision making is based on blood testing. So you start there.
Yeah.
So anything you can do to improve the patient experience is going to be welcome. And the difference between our 79 Net Promoter Score, which is what we've earned during the 18 months of commercialization, and the negative Net Promoter Score that the leading lab companies have achieved, is pretty substantial. So it's not like we're saying, well, this is
negative versus 79.
Yeah. So we're not just saying this is a little bit better. We're saying that we've shown that this is a lot better.
Light years better.
Yeah, light years better. And so at the same time, we're also saying you don't need a phlebotomist in your clinic necessarily. Now, I'm not saying that there won't be a role for phlebotomists, because there are. We have a very broad menu of tests, but we don't have all of the tests in the universe. Right. And so there is plenty of need for phlebotomists. And I think that need is actually only going to grow moving forward. But in an ambulatory care setting, where you can, offer a patient-preferred experience, and you don't need a phlebotomist, I think it's a tremendous advantage. So, basically, again, it's patient-preferred experience, which is important to competitiveness, and staffing efficiency, which relates to you don't need a phlebotomist. Plus, as I mentioned, the sample preparation device saves labor time on the back end of phlebotomy. So what people sometimes don't understand is, you collect blood, but then, there's a lot of labeling and centrifugation and manual work that grows, into the process after you actually collect the blood. We've automated all of that stuff. And so, that's a tremendous advantage, I think, too.
That's great, Webb. And, as I think about the end user of this system, you've got different populations. You've got the elderly, you've got, workers, you've got kids. You covering all of them?
No, well, we're not covering all of them. So at the moment, this is 18 and over.
Okay.
As you can imagine, we're working on pediatrics.
I would imagine.
But again, we have, we've now, successfully with BetterWay tested, thousands and thousands, hundreds of thousands of patients, and of all, demographic groups. So other than pediatrics.
Sure.
And so it's not, I don't think the patient preference is focused on any particular segment of the population. It's just generally speaking.
Oh, for sure.
But, if you think about it, one of the biggest healthcare problems we have in this country is chronic disease. And so people who either have chronic diseases, in some case multiple chronic diseases, or are in the danger zone or the red zone, those people, need to get tested on a regular basis. And so when you need to get tested on a regular basis, the advantage of being able to offer a process that actually is patient friendly is even more of an advantage. So basically, the more you need to get tested, the more of an advantage this actually is to be able to offer it.
Definitely. Yeah. And my head was just going to, all right, somebody needing to take off of work to go to the doctor and the phlebotomist, or if you're an elderly person that doesn't have transportation, right? Like that's only one ride you have to get. So like when you think of care logistics and care coordination, it seems to me that it also becomes a lot easier.
Yeah, no question. I mean, again, the convenience that, the large providers are already building into the system, we're just leveraging that. But there's another dimension to this, which is, in some cases, a patient goes to a provider in order to diagnose the patient properly. The clinician needs them to get tested. If they don't have an on-site blood collection capability, they get sent to a patient service center, operated by, one of the large traditional companies. Yeah. In a reasonable number of cases, the patient never actually goes to get those tests. And so essentially that provider has lost the patient for all intents and purposes. And that's bad for the patient, bad for the provider, and also bad for the payer at the end of the day.
Yeah. Yeah, no, in a big way. So in markets like Austin with convenient blood testing, what convinces health organizations that better lab experiences translate to better business?
Well, as I mentioned, we started to commercialize BetterWay in Austin 18 months ago. And that's largely where the 79 Net Promoter Score comes from. And we've also trained, hundreds of people who, the vast majority of whom had never collected blood before, to be able to administer the system. And those include people, cashiers, for example, where if you had asked them, how do you feel about collecting blood? Usually at the beginning they say, I don't think I can do that. But we have a less than 3-hour training program. It's very structured. And at the end of the day, we've enabled them to do it. So, I think the advantages of this system are they're not only pretty strong, but they're pretty self-evident. If you take a closer look at it, what this company has done over the past 10 years to really develop and validate this technology to this point is truly impressive. And as I say, I'm not taking credit for it, but I believe that it's going to be transformational in the healthcare delivery system.
I agree with you. Well, look, it's always fantastic to connect with you, Webb. I enjoy these conversations because of the experience you share. And then now with the work that you guys are up to at Babson with BetterWay, it's just inspiring. So I always look forward to our next one. Before then, just give us a closing thought for our viewers that they should think about, and then best ways they could get in touch with you and the Babson Diagnostics team.
Yeah, well, if you want to learn more about it, you can just go to betterway.com. A lot of information is there. We're very transparent about, all the data. And you can see the full, menu of tests. So, it's all there for everybody to see, patients and, and providers alike. As I mentioned, we have been engaged with health systems, large health systems, and other providers, and, basically sharing our technology with them and moving very rapidly towards pilots, which we'll be announcing, I would say, probably beginning in the next quarter. In fact, I'm quite certain of it. But, if there are any providers out there who want to learn more, we're always happy to have those conversations and excited to have those conversations. I really feel good about being able to tell the story and explain the benefits of the service, again, to all constituencies, to patients, to providers, as well as to payers. And we're making progress there as well. So, if you want to learn more, reach out to me. You have my contact information, Golinkin at Babson, web.golinkin at babsondx.com. And, let's talk.
I love it. Well, there you have it, ladies and gentlemen. Golinkin. He is the president of Babson Diagnostics, giving us the latest update on BetterWay. In the show notes, you'll find all the ways to get in touch with him and the team. So make sure you do that. Share this interview with your friends. If you're a provider looking for a better way, it exists, and it's actually called that. So check it out in the show notes. Make contact. That's why we do these types of things. Until next time, we'll see you soon. And Webb, thanks for being with us again.
Yeah, Saul, it's always a pleasure.
Always a pleasure.